first myth that I'm hoping that we can get into is this idea that the 340B program is exploding.
Yes.
Why don't you just dig right into that?
So I think my issue with the word exploding is that it has a negative connotation. And I think since 2010, when I was actually, going over to HRSA to work there, there's been a huge growth in the number of entities that are participating in 340B, but that's because 340B is so important to community health centers, especially. So I think when the program gained prominence and expanded a little bit in eligibility in the Affordable Care Act, people started realizing what an amazing potential revenue stream this could be for their operations and for their patient care. So it's definitely true that the number of entities participating has increased, but that's how the program's supposed to work. Every program who is lawfully eligible for it can participate. So we actually want entities who are eligible to participate and then be compliant with the program when they're there. And I think, there was a Congressional Budget Office report that came out this week about the growth in purchasing and drug purchasing in the 340B program. And that has gone up too, but part of that volume is just the increasing price of drugs. So I just think the 340B program exploding, to me, has this connotation that entities are doing something wrong, whereas they're really just taking advantage of the program that they're eligible for.
Yeah, and I would add to that, one, to your point, I remember 2010, I remember how few health centers were engaging in the program at the time.
Yeah.
That's changed because they see the value and obviously how it's enabled them to basically provide services that they would otherwise would not be able to.
Right.
So I think you're spot on, but that language is harmful, and I think it leads folks to believe something that isn't necessarily true. And I will also just call out that when you look at the total spend, and we've already talked about this, but just to reiterate, you look at the total spend of the 340B program, health centers are 5%.
5%.
So yes, I'm not debating it is a significant number when you look all in, but the segment of that belongs to health centers is pretty minimal in terms of the bigger picture.
And can I add one thing too?
Yeah.
I think that health centers have gotten so much more sophisticated as providers of care in the last 15 years. I think that they've really become that health home for so many people, which means they're more responsible for people's prescriptions. So that also, the participation, but also I think it's a sign of community health centers taking care of the whole patient and being able to manage which different drugs they're on and really take control of that prescription purchasing, which is a good thing. We want health centers to use that expertise to manage and coordinate really complex care.